women of the home, we know that it's not just your health you are responsible for. You are also responsible or take charge of the health of your children, the health of your husband, the health of your parents. And whenever my husband goes to the doctor, he doesn't know anything. So I've been talking to the doctor instead. What are you here for, Abiola? What happened, Abiola? So that's how it is. So we just have to know even about everybody around us. So let me start this talk. I want to cover some important things: physical health and mental health, and then family health. So let's start. Now, I've already been introduced. I think my claim to fame is that I'm a mature trusted doctor, but also I'm an emergency critical care physician. I'm the founder of Emergency Healthcare Consultants. We work in the emergency and critical care capacity building. And I'm also the medical director of Aprial Hospital, which is our main branch is close by. It's a 300-bed hospital system, and we provide comprehensive health care. So I'm happy that we were able to give you some health checks yesterday. Wow. What are we trying to do in this session today? Wow. We want to talk about some of the things you ought to know as women for your own preventative health care. I want to talk about some of the screening that you must be doing, talk about emergencies and how you respond, and also how you become a champion for health in your home and in your congregation, because with our clergy wives, you are the anchor of the vicars and priests. You are the engine in the battle. So I know that it is very important that I will talk to you because you are the ones that will drive this in churches. So thank you very much for giving me this opportunity. The first thing we are going to talk about is hypertension and diabetes. 1 in 4 Nigerians have hypertension. Many of us have diabetes. In the past, they used to talk about malaria, Lassa, typhoid, and those things are still important. But now, when we are living longer, and people are eating egg every day, we are beginning to see different things coming into the hospital. As a matter of fact, whenever we are in hospital during a shift, almost 20 to 30% of the problems you see are related to hypertension, either undiagnosed, poorly controlled, or a hypertensive coming in with a stroke. We see a lot of that in the hospital. So I thought it was important for us to discuss this today. So it affects almost 50% of adult Nigerians. We need to think about that. Everybody sitting here, 1 in 2 might have high blood pressure. And that is why it's very important that we screen and follow up. This environment that we're living in is very stressful. These are some of the things that cause the blood pressure to rise, as well as salt. One of the biggest culprits of that is Indomie noodles. That spice packet is evil. Even if you must eat it, please throw that one away. The salt in that thing is excessive. What about your seasoning cubes, your Maggi, your no? There are lots of salt in them. So we have to take about these things when we are cooking. So what is a normal blood pressure? Anything of 120/80 and below. And the recommendation is that you check it and check it every 6 months. Normally, your pressure may be high maybe once, you are nervous, you are tense. We don't diagnose your blood pressure unless it goes up 3 times at 3 different times. So everybody I hope had a screening yesterday. You must screen yourselves 3 more times and then see if there is a concern for blood pressure. Please don't wait. It's important to do this now because, as I said, it's very common in Nigeria. The second thing is type 2 diabetes. There are 2 types of diabetes. The one that we are worrying about for us and adult women is type 2. This is the type that comes on as we get older. It's not because your body is not making insulin. It's because your body stops responding to the insulin. What are the things that give us a risk for this? Our lifestyle. So when we start to gain weight, when you are not walking, when you are not exercising, I think when people get exercise, they think they have to be running. Actually, you can just walk. 30 minutes, 3 times a week, take a walk. That's enough. Try to walk after your evening meal. These things are important and are easy to do. And typically, a simple fingerprint test, if your number is below 5.6 millimole, then you are scot free. What about some of the other things you can do? Our food. Our food. They cook your father and the oil is on top. And it's very sweet, but it is not good for you. We need to actually decrease the oil in food and decrease the portion size. You cannot have a mountain of rice. It's not possible. It has to be smaller than that. Why are these things important? Because they can damage our kidneys, they can damage our hearts. They are risk factors for heart attacks. They are risk factors for strokes. And so, if there is one thing I want you to understand today, which is why we did the blood pressure and sugar check yesterday, diabetes and hypertension are rampant. And we really need to make sure we are taking them very seriously. If you have not seen your doctor in some time, please go and make sure that these things are checked. Okay, what are the other things for our own health we need to know? Actually, in Nigeria, breast cancer is the commonest female cancer in Nigeria. 1 in 8 women globally have breast cancer. A few months ago at Nativity, we had a group come and do breast cancer screening. And that was very helpful. They found some things and some of us went for checks. In your own home, every month, you want to try to do your self-breast exam. It's very easy. You put your hands behind your head and you just press and see if you are feeling any lumps, any bumps. And why it is important is because if you have been doing it, then over time you will know how things are for you and you will pick up when something abnormal comes up. A lot of these cancers are treatable if you are detected early. So early detection is important. The second one is cervical cancer. The cervix is inside of us. It is the entry point to the uterus where you carry your baby. And that cervix, it is a small disc. It's actually the second place that is the most common for cancer in Nigerian women. And the treatment is not easy. So once again, very important that you are having your pap smears at your gynecologist every 3 years. For the young girls, there is a vaccine, HPV vaccine. Please encourage your congregation to make sure the girls are having this vaccine because it actually helps to prevent cervical cancer later on in life. And it is widely available, HPV vaccine. Now, most of us, unfortunately, in Nigeria, presents quite late. Our health system is not very strong. And what ends up happening is a lot of people have cancer and coming in the late stages when it becomes difficult to treat. If you are caught in the early stages of breast cancer, there is a 90% survival rate versus late stages where survival drops to less than 30%. It's very important that we take these things seriously. If you are not healthy, your home cannot be healthy, and by extension, the church is not healthy. So please take it seriously and check yourself. Last thing, colorectal cancer, another one that is rising. Our food is getting more starchy, more fatty. We're not cooking the way our grandmothers used to. There's less fiber. Most of us, like myself, are going to the store. We are not making the rule at home. And so now we are eating a lot of things that we are not controlling, which means that the food is sitting longer in the guts and our bowel habits have changed. This is increasing the risk of cancer in the population. So we are advising also that you screen for this with your doctor. The screening for this is annual. It's a simple stool test that you can do to help us understand if you need to have other screening for cancer. The last thing is your family history. If cancer runs in your family, you need to start these checks earlier because then you are genetically already at a higher risk for this. Most of us will be fine, but prevention is better than cure. So please start to do the checks and encourage your husbands to do it as well. Ensure that the girls are getting the HPV vaccine. Let's talk about the mind. which is the next thing I wanted to discuss. You know, in most of us, our culture is taboo, right? You don't say it when somebody has problems mentally. But as far as we are concerned, physical and mental health are all connected. And it's not your fault if things are overwhelming. Many of us are depressed. Many people are suffering from anxiety. These are trying times, economically, financially. A lot of families are struggling. And it's causing a lot of anxiety in families. And so, it's important that we acknowledge this and make sure that we are not making people who come to us for counseling or admit to being overwhelmed feel as if there is something wrong with them. And thankfully, we are all people of faith, women of faith. There is God to also help us to get through these trying times. Unfortunately for us in our country, depression and anxiety are frequently underdiagnosed. It's important that we have an ear for this and we are listening and counseling people when this happens. I want to also raise postpartum depression. It's not a joke. Many women actually get terribly depressed after birth. They really go down. And there's a chemical reason for that sometimes in the brain too. Please, I'm asking us to also support the new moms, because when they come to you telling you, I don't have energy, I'm not wanting with the baby, I don't want to do anything. It's true, there is a condition called postpartum and it requires medical attention. Please, some of the things to watch out for: prolonged sadness, withdrawing from activities, a woman who was very active in the church who suddenly doesn't want to do anything, somebody who's always sleeping, doesn't want to go to work. These are things that should raise a red flag that maybe we need to talk to somebody to help you out. Burnout, certainly in our own profession as clinicians, is a big deal. What is burnout? We're tired. And it's tiredness that is not resolved by sleeping. You take a leave and you are still tired. It's mental, it's exhaustion from the work that you are doing. I think that the clergy and our ministers in the church are also people who need to be there all the time, 24/7 for emergencies. There is burnout in the clergy. You get tired of constantly being there for the congregation. Please, it's important, even though we are troubling you, boundaries. Sometimes you turn off your phone, right? Sometimes, please let us have a schedule. Who is going to be listening to the congregants this week? Because I need to rest. Burnout is a real thing. And if you are burned out, you are not effective in your role. When the doctors are burned out, they start making mistakes. So I'm sure that when the clergy is burned out, then you become a very irritable person when somebody is telling you their problems. So let's also make sure that we listen to ourselves. There's no need to stigmatize these things. Mental health, like physical health, is important, and they are connected. Now, protecting your family. What are some of the things we can do there? Let's start with the children. Right? Because this is part of the things that will stress us. You are the moms, you are the ones that will be sitting there. The men care, but they can leave. You will not. So it's important that we know these things. Please make sure that the immunization schedules are there too. That the children have been immunized. There are a lot of things that we can prevent simply by making sure that the children are immunized. What are the danger signs in the children? Fever, fast breathing, they are not eating, seizures, being very weak. These are some of the things that if you see them, it's not, oh, malaria, let me go and buy donuts. You really need to think about what is going on. In our Nigerian children, many of them have easily respiratory conditions. They always have a lot of cold, cough, pneumonia, and a lot of gastroenteritis when they start urinating and stooling a lot. And a lot of it is driven by malnutrition, right? Just because someone is eating noodles every day doesn't mean that they are well nourished. A balanced diet is very important. For pregnancy, in our mothers, severe headache, blood vision, when all of us have facial swelling, but sometimes the swelling is too much. They are not feeling the baby move. They start having vaginal bleeding during the pregnancy, or worse, they lose consciousness. These are things that if you see, you need to be concerned about.